Welcome back to my channel. If you are new here, my name is Obi, a nurse with a passion for mental health, addiction recovery, helping break the stigma that surrounds this critical area of healthcare. Today's video is truly close to my heart. I want to share with you the incredible and sometimes overlooked role the nurses play in mental health and addiction recovery, and how we as nurses can inspire change, support healing, and truly make a difference in people's lives. So whether you are a nurse student, a new graduate, a seasoned nurse, or just curious about fit, stay with me. This is going to be honest, empowering, and hopefully a call to action for many of you. Let's start by talking about why nurses are so essential in the space of mental health and addiction recovery. First, mental health and physical health are deeply connected. We cannot separate the mind and the body, and nurses are uniquely trained to care for both. In mental health and addiction recovery, nurses are often the first people patients trust. We are at the bedside, in the clinic, in the community, listening and assessing, noticing subtle changes. All those little changes that happen. Nurses are the first point of call. We are the ones seeing those changes. We provide holistic care. What do I mean by holistic care? That means we are not just focused on diagnosis or medication. We give care, all-round care. We care about the whole person, their struggles, their strengths, their hopes, and their fears. And there is something I want every nurse to hear. We are agents of change. We advocate for those who are often unheard. We help reduce stigma, both in our workplaces and in society. We aren't just helpers, we are lifesavers in mental health and addiction care. You may ask, so what exactly do nurses do in mental health and addiction recovery? One of those things that we do, number one, is assessment. We assess mental status, mood, risks of harm, signs of substance use or withdrawal. Nurses are trained to see what others might miss. Number two, advocacy. We speak up when our patients are being judged or dismissed. We fight for fair treatment, dignity, and resources. Education is the number three one. Nurses teach patients and family about mental illness, addiction, medications, coping skills, and how to prevent relapse. Number four, crisis intervention. We respond during suicidal crisis, psychosis, overdose situations, or severe withdrawal. Our calm, trained presence can de-escalate and save lives. Care coordination. Nurses are at the center of the team, working with social workers, psychiatrists, addiction counselors, peer support workers. We work with everybody. We are at the center of the team. Medication management, from administering meds to educating about side effects and watching for dangerous reactions. Nurses play a crucial role in keeping patients safe. The next one is therapeutic communication. Sometimes just how we listen and speak can be healing. We create safe spaces for patients to express pain and hope. Let's share 2 stories that remind me why our role matters so much. I once cared for a man who was deep in addiction, homeless, and had been in the hospital. Many had written him off. But through consistent, non-judgmental nursing care, checking on him, advocating for him, helping him accept a detox program, he started to believe in his own part again. Months later, he came back and said, were you the only one who treated me like I mattered? You were the only one who treated me like I mattered. Number 2, a young woman with severe depression and anxiety came into the hospital during a suicidal crisis. I sat with her, listened, and helped her connect her with inpatient care and outpatient follow-up. Month later, she sent a message through the hospital. Her husband is there waiting. Thank you for seeing me when I felt invisible. These stories are rare. That is what nurses in mental health and addiction recovery do every single day. If you are a nurse or nursing student watching this and you feel drawn to mental health or addiction work, here's how you can grow. First way you can grow is by get certified. Consider certification like certification in psychiatrist, mental health nurse, board certified, or certificate in addiction registry nurse. Get certified. Consider certification in psychiatric mental health or board certified or certification in addiction registered nurse. Number 2 thing you have to do is find a mentor. Seek out experienced mental health or addiction nurses who can guide you. Number 3 thing is keep learning. Look into trauma-informed care, motivated interview, reduction strategy, practice self-care. This works. It can be emotionally heavy. Set boundaries, debrief with colleagues, take care of your own mental health. We need more nurses to embrace mental health and addiction recovery as honorable, essential work. We need to challenge the outdated mindset that mental health nursing is easy or less important. Let me tell you, this work takes courage, skills, and heart. I want to encourage all nurses, be proud to be part of this field. Challenge stigma when you see it in your workplace, community, or even without yourself. Mentor the next generation of nurses who will continue this vital work. Thank you so much for watching. As nurses, we have a secret day to heal, to advocate, to comfort, and to fight for justice. In mental health and addiction recovery, that duty is more important than ever. Let's rise to it. Please share your thoughts in the comments, whether you are already working in mental health, considering it, or just want to learn more. Let us build this supportive community together. If you find this video helpful, give it a like, subscribe, and share with a fellow nurse or a student who might be inspired. Thank you so much, and God bless.